So welcome in. This is Christy Hendricks with Change of Shift. Good to have you back with me. Today I have a guest who is here to tell us all about patient advocacy, and which is, I think, really an area that's just prime for nurses to go into. So if you've ever thought about being a patient advocate, you've got to stick around for this show because there's so much here that you're going to learn. Okie doke. So my guest is actually, her name is Llewellyn, and Anne is a registered nurse and healthcare leader with over 40 years of experience as a critical care nurse, a case manager, a professional patient advocate, an educator, and a digital journalist. She has expertise as an independent case manager, specializing in catastrophic case management, workers' compensation, and long-term care. Also, Anne is the past president of the Case Management Society of America and was one of the original authors of the American Nurses Credentialing Center book, Case Management Review and Resource Manual. She's written and lectured nationally and internationally on case management, patient advocacy, and care coordination. Anne's blog you can check out over at, it's called Nurse Advocate, and you can check that out over at nursesadvocates.net. Okay, so let me welcome in Anne Llewellyn.
Hi, Christy. How are you?
I'm doing well, Anne. How are you?
Good. Good to talk to you again.
Good to see you. Okay, so we've got, we have viewers here that are thinking, hey, patient advocacy, that sounds kind of interesting. What is it and how do I get into it? So, but before I go into that, I just want to back up and find out from you, what's kind of, well, we read a little bit, we heard a little bit already about your history, clinically. So how did you get from that into like going into your blog and becoming a nurse entrepreneur or starting in patient advocacy?
Okay, well, basically I've had a couple different passages in my career. I started out as a critical care nurse, as you mentioned, and I was in Philadelphia. When I moved to Florida, I moved into case management, and that was a new area for me. I really was not sure what even case managers did. This was back in 1988. But I was able to a job in patient case management, which really helped me understand that it's so important when people have a chronic illness or a catastrophic illness, they can do very well medically getting care in the hospital, but when they go home, they really need people to help coordinate care for them. They need resources and assistance. And people are very resilient. So even somebody with a catastrophic injury like spinal cord injury or brain injury, they can do well if they have the resources. And that's where case managers come in by helping to coordinate care through the continuum. Once they leave the ICU, once they leave the emergency room, and be able to do well on their own, but they need the tools and resources to do that. And the education. We in healthcare really we're expecting people to do a lot without much information. So even myself, I was a nurse for 40 years, as you said. I got a brain tumor 2 years ago, and I needed an advocate to help me, somebody to help me have a voice, because I was not cognitively aware of what was happening to me. So I had actually, my husband was my advocate, as well as I had a friend who was a professional patient advocate, and she assisted us in walking through the continuum of care. So that was how I really understood how important it is for patients to have an advocate.
Okay, so what is the difference then between a case manager and a patient advocate?
The difference is that the case manager usually works for the hospital where you're in, or at the insurance company who might provide your coverage, where a professional advocate can be somebody who's independent, works for themselves, works for you directly, you meaning the patient or the caregiver, and they're paid directly by you. It's not covered by insurance. It's not part of um, an insurance plan. You pay privately for a healthcare advocate.
Okay, so it's private pay. So the patient pays you directly, or I would think in a lot of cases maybe the patient's family might pay.
Families, yes. A lot of times, especially with elderly patients. For instance, when my mother was still with us, I lived here in Florida. My mother lived in Philadelphia. We had an advocate who helped her, and I paid for that advocate to go and take her to the doctors to find out what she had COPD and what any new changes, because I couldn't get to Philadelphia for those doctor's appointments. She needed some assistance with maybe having housekeeping. So the advocate, I was able to work with the advocate to, how's my mother doing? Does she need any support? And these are some things that might help her. And the advocate was able to arrange that. I paid the advocate to do that because I wasn't right there.
Right.
So when people are long distance, that helps to have somebody who's right on site with the family member who needs the assistance.
Okay, and that makes a lot of sense. And now that I see, for me, just in our family, I live up in Idaho. My parents live down in California, and they need an advocate because, my mom is showing signs of dementia, and my dad is, his physical mobility is nil. He can walk 10 or 15 feet, but I'm not down there to help them arrange groceries and transportation and, housekeeping and all of that stuff. So it does help. Well, and the other thing too, I'm thinking is I would try to be on the phone with them, telling them what questions to ask the doctor. And they don't know these things. They have no idea what to ask the doctor. So they'll be sitting in an appointment and they're just nodding yes, saying, okay, yeah, whatever you say, doctor, and not knowing what to ask.
Yeah.
So,
and that's what an advocate can do with someone who's medically complex, is to review with them before they go to an appointment what some of the challenges are, and then have that information on paper so when they go, they're there to help the patients talk, to encourage the patient to ask questions. Didn't you want to ask the doctor about this? Because people sometimes, we hear white coat syndrome. People get nervous in front of the doctor. They don't want to take up too much time. The doctors really do want to know what's happening because that helps them get a better picture. So the advocate can help the person or the family members have a voice. They're not used to being in a medical situation, so they're not used to knowing that it is okay for them to ask questions, and it's very important for them to ask questions. So having an advocate with you allows that to happen.
right. And I think, it goes back to what we were saying about nurses being in a good position to be patient advocates, because, nurses are really good at translating that medical information into kind of normal, normal people talk,
Plain language, yes,
plain
definitely.
Language. Because I know that, for my parents and I know everybody, else, elderly and people in complex situations, they don't a lot of times really know what the doctor's talking about. So you have sort of this head nodding sort of thing. And just
even if
they're afraid to ask,
Right. They're afraid to say they don't want something that the doctor wants to do. And that's important too, because sometimes people want to go a different route and their doctors may not even know that. So having somebody there, again, to let them know this is okay, yes, you should ask about that. Because even if it isn't the right thing, the doctor can explain that. Well, we're not really there yet. Maybe we'll consider that in the future. Or maybe we are ready for this. And this is a good time to introduce hospice, palliative care, whatever it is, end-of-life issues that people wonder about, that are sometimes really afraid to ask about. So having an advocate can give people a voice. It can help remove some of the confusion in the healthcare system. It can help people get the care they want. sometimes the healthcare system, and I've said this a couple times, the healthcare system is really designed for the healthcare system. It's not designed for the end user of the healthcare system, like the patient. So learning how it works, learning what we have can do is something that advocates can help people. They give people information. They help them do research to find out what some of the other alternatives to the plan of care may be. So they can actually discuss it with their doctors and find out if it's something that will help them or be good for them at this point. So the advocates are there to really, again, if you think of it like a financial planner, I have some money to invest because I want to invest for my future, but I don't really know much about stocks and bonds and mutual funds. So I actually hire a financial planner to let them know what my goals are financially, and that financial planner helps me get there. So you can say the same thing about an advocate, that an advocate will help you voice your goals, understand your goals, and help you and the rest of the healthcare team meet those goals.
Okay, and that's a good breakdown of what an advocate does for a patient. So they're taking care, or they're seeing to them like their medical needs. They're anticipating, they're translating, and doing all those
things. Doing
things.
Research. They're helping people to understand what is going on and what other alternatives might happen for them.
Right, so they can make an informed choice.
Yes.
Okay, so what would you say for a nurse thinking about becoming a nurse advocate? What would you say the first steps that she would need to take to get that in motion?
Right. Well, I would definitely recommend reading about what patient advocacy, and there are several terms for advocates. You could be a health advocate or a patient advocate. So those terms are kind of interchangeable. And so reading about that, one of the resources I would recommend would be the Patient Advocate Institute. It's patientadvocatetraining.com is the website. That has a lot of material, handouts on that website that you could actually read, learn about what advocates are. There's different types of advocates. There's health advocates who might help coordinate care, help you getting things done with regard to your care. There's also billing advocates. If you're in a hospital situation and you have a complex medical condition and it's costing a lot of money, you're going to get a lot of bills, and the billing advocate can go through the bills and evaluate them to make sure that they are pertinent to your condition and that they need to be paid or not paid, or negotiate them for you because you can't pay them. So there's different types of advocates. There's also advocates for elder care, people who are elderly and their children, like you give the example for yourself. You're in Idaho, your parents are in California. Elder care advocates can help take care of some of those needs. Some of the other websites.
Yeah, I'm actually doing a screen share as you're talking, but let me just start. Right. Let's just start over here at your website, at your blog, nursesadvocates.net. So I have that up on the screen. I don't know if you can see that.
Yes. Well, my blog is really came out of my experience of being a patient myself. I was, as I mentioned, I had a brain tumor 2 years ago, and I did pretty well. But I realized how scary and how difficult it is to be a patient. So I've started to write this blog to share my experience and to help people with some tips that I found helpful for myself as a patient. And I write this for the patient, their caregiver, and also for the healthcare team. So the healthcare team recognizes some of the issues that patients face, and they can help them adjust to them. So the blog is informational. There is no cost to it. It's just something that I write, and I post up about things that I faced myself or that I know happened to people so they can better navigate the healthcare system.
Okay, okay. So let me move on to another, and here, this is the Patient Advocate Certification Board. Because, and talk to me a little bit about this, because I know that nurses are probably wondering, well, do I have to go back to school? What kind of training do I get? What do I do?
Well, right now there's several organizations that have training, patient advocate training. But many nurses might already are qualified to be patient advocates. The fact that they have a license, they have a nursing license, and they're understand medical conditions. Many understand billing. If as a case manager, I understand health insurance and how it works, and I understand the safety net systems and how that works. So if you are already a professional nurse, you're a licensed professional nurse, you might be a certified case manager. Moving into patient advocacy is a natural course. It gives you the role to be an independent professional, and it also allows you to help people navigate the healthcare system, which you understand. So the Patient Advocate Certification Board, we are currently developing the first national certification for professionals who are in patient advocacy. And if you wanted to sign up, you can sign up on this website, put your email in, and you'll get updates as this program, this certification rolls out. We anticipate the first exam to be given in March of 2018. The registration for this exam will open up probably right at the end of December or first of the year of January 2018.
Okay.
So,
okay. So right now, there's not a certification that's required.
no, there's no certification. There's no license. It's really background from what the individual advocate brings.
Okay.
And I would like to mention that there are, nurses make good advocates because we are advocates by training, but there are many people who come into advocacy who are lay people, who are maybe have business degrees or marketing degrees or other types of educational backgrounds. So the field is pretty open as to who can be an advocate. Many people become advocates after they've gone through a healthcare challenge themselves because they've seen how difficult it's been and they want to help other people go through it. So the criteria for an advocate right now, we are not establishing definitive eligibility criteria, but we are going to let the test determine. People pass the test to get the certification.
Mm-hmm.
But after the first 4 exams, we're going to be collecting data as we go forward about what educational requirements would best help a person be an advocate. Experience, your previous background and experience, and your educational background. So we will be looking at that in the future. So I hope people, if you are interested, sign up. Right where you said subscribe for email updates, you can put your email address in there and keep up to date on this because it is an emerging practice for people to get into and something that is going to grow as we move forward as a country in healthcare.
Right, and it seems to me that if a nurse takes the certification exam and gets that certification as a patient advocate, she's going to be kind of like a leg up on everybody else, you know. Because of course, if you have your nursing credential plus a credential as a patient advocate, that's going to weigh heavily, I think, when it comes time for people, shoppers, healthcare shoppers, to selecting a patient advocate that they can trust.
Exactly, and that's important from the consumer standpoint.
Right.
We do encourage people to ask what people's educational background is and what their experience is in advocacy. And people who do have experience, you're right, do have a leg up on others. And so that's a good thing to put on your website. If you become a professional advocate, you usually develop a website. You could put that information on your website so people can find you and know how qualified you are. And then having the certification, once it becomes available, is another plus that people will look for.
Right, right. Okay, let me go here to, and I believe this is Alpha.
Yes, the Alliance of Professional Health Advocates. The short name is APHA, APHA, and it's a professional organization, and it's very good for people who are starting out, trying to learn how to market. Many nurses want to come into this, but the challenge is how to get patients, because if you're going to do it as a business, you're going to have to know how to market and market yourself. And so this website is for independent advocates, other professionals, maybe case managers, nurse navigators, who are involved and want to learn how to be independent. I think that's the focus of the website. A lot of good information, a lot of networking opportunities to learn. So it's a nice website. There is a fee to join, but it's very reasonable, and you can get a lot of good information from it. In addition, it also has a consumer side. Consumers can come onto this website and put in their zip code and find advocates in the area where they live, because that's an important, how do people find you? And at the Alliance has a section of that people can find an advocate.
Okay, yeah, I'm just kind of taking a look around here. Yeah, here, find a patient advocate. That's wonderful. Mm-hmm. So if you're a member, then you're going to be in that directory and people can find you. And right. I would imagine too, do you have your own page? Like, do you have kind of like your own?
Yes, I think there is like a section, everybody has their own little marketing, and then it can link to your website, link to what you have available.
Wonderful. So then you can put your credentials in there too. So right. People can kind of maybe scroll down and see, oh, well, here's a registered nurse and she's like certified, let's mm-hmm. take a look at that. Okay. All right, let me move on to the next one. Or I was kind of looking though, you were talking about marketing. I wonder if it would be under tools.
Some things might show up there, but again, as you get deeper into the website of APHA, you'll find more information.
Okay, wonderful. Now, I would also expect if you go, like say if a patient or family member goes in here, can they find, like, I need a pediatric advocate, or I need a, I don't know.
They just actually changed this searchable. When you click on find an advocate, it may ask you some questions, what zip code, and then it may ask what specialty area that you're looking for. So I know they just changed this, and I'm not familiar with how deep it goes, but yes, usually they will say what people specialize in, like mental health, behavioral health, pediatrics, elder care, catastrophic, that type of thing.
Right, yeah, because you kind of, like here, I'm just looking here in my area. So I see one, or two actually. Okay. I guess we're kind of, not a lot going on up here in Idaho.
Yeah.
That's okay.
Some places are more heavily, like California has a lot of advocates, and Florida has a lot of advocates, other states, Washington, Maryland. So, it's really, and again, it's growing. It's an emerging practice. More and more people are getting into it.
Okay. Well, let me move on to another site that is going to be helpful.
This is another of the professional organizations, the National Association of Healthcare Advocacy Consultants, which is a professional organization for people who are in advocacy. Now, they just had their conference, I believe it was November 2nd, so that won't be happening for another year. But again, they do have webinars for advocates. They have, for professional development, and they give you a lot of resources that you can use to help, understand advocacy better and build your practice up.
Okay, so that looks like a super good resource. I saw they have a podcast right here. Podcast.
Yeah, they have some different programs that they've recorded and that are online that people can listen to on demand.
Okay, excellent. So that looks like a super good resource for nurses. Let me go to another. Okay.
And then WASHA is an example of a regional professional organization. This is the Washington State Health Advocacy Association, which is for people who live in Washington State. And but other advocates do go there. Like I went to their conference from Florida last year. I went to it. But again, it's a local regional professional organization, and many stakeholders come to that who are employers, you know, people from long-term care organizations. You can meet people, network with, to help you learn about business opportunities as an advocate when you join these local organizations. They're good networking opportunities for people.
Right. Okay. I'm sure that you can just do a search and find.
Yeah, they have I think they have a place too to find an advocate.
Okay. To find an advocate. And then were you saying too that there are other regional associations?
Yeah, more and more are popping up, you know, as again, more people I know in Chicago, they have a conference, and there's a group of advocates in Chicago, and they have an organization. So yes, and I think we're going to see that grow more and more too, because as more professionals get in it, the way we are going to grow ourselves is to network with each other.
Okay. I'm like kind of looking around here, but you can see just like an example of previous previous meetings and such, topics, chronic illness, health advocacy in Spokane. That's right across the state line from me. Okay, all right, so let's take a look at that. Let me look at that again. So that was WASHA, that is in the state of Washington, but it looks like they have events and such of interest to anybody interested in going into patient advocacy. You don't have to be in the Washington area.
Right, you can, a lot of it's virtual. That's why, because again, it's new, so we're trying to reach people from different areas. And
Okay, let's take a look at the next one here and tell us about this site.
This is the Professional Patient Advocate Institute, and this is you know, a place, again, they have certification programs. If you want to learn introductory information about what patient advocacy is, they have a good online on-demand course that you could actually listen to. They put out a newsletter that comes out once a month with tips and trends happening in patient advocacy, and then some tools and resources that people can access. There was a patient advocate survey done by this organization a couple years ago, which will tell you under free the patient advocate report. I think that's it, right where you are, Christy.
Like up here, reports.
Scroll down. I can't see because the picture's in front.
Let's see. Well, here's reports.
Yeah. Okay, go in there.
Take a look and see.
Yeah, these are all free. When you do click on them, you just have to put your name in and, you know, your email, and then you can get the report for free. So they're very worthwhile to look at.
Okay, I see, you know, and I see we were talking a little bit about marketing. I'm wondering if this is a bit of marketing for patient advocacy, business strategies.
Yep.
Okay, it's nice to have that, because sometimes, you know, coming from nursing, we know medical, we know nursing, we don't always know business. So it's helpful to have that information.
That's where most nurses really do have the most trouble, is finding out how to market themselves, getting out in the community, talking about yourself, and charging people. Because again, this is a business, so we're not doing this for free. We're doing this for a business. So we have to be able to feel comfortable enough to charge people. And that's something that you learn as you go forward.
Right. And actually knowing who to charge too.
Right.
You might, you know, in some cases you might not be going directly to the patient who needs the advocacy. You may be going to a family member or somebody that is actually.
And you know, you have to draw up contracts. You have to have a contract which will explain what you will do, just because you are taking money from people. We encourage people to get background checks to make sure that they, you know, because you are working with consumers when they're vulnerable. and to get a background check so you can say you are clear, you don't have a criminal background.
Mm-hmm.
And so those are the things that you learn as as you become independent. These are things you have to have your own malpractice insurance, which is important because, again, you're doing things independently. You're not under the auspices of a hospital.
Right, right. And I would imagine that that you're able to get that information, like say for like liability insurance or something, and those kinds of resources through somebody, one of the associations for patient advocates or
Yes.
the PPAI or something like that can steer you in the right direction as far as, malpractice insurance, legal forms that need to be signed.
Consent, the HIPAA consent form you need when you work with somebody independently. You have to have a release of information from the patient or the family if the person isn't, whoever their caregiver is, if they're not competent to sign. So you can get information from various providers. We have a HIPAA law that we need to respect. So as an advocate, I need to have a consent. I have permission to ask questions on behalf of this patient. So they're important things that we have to get. So there's a wealth of information out there. On this, after this webinar, if you wanted to put my email address up too, if people had questions of how to get into this, we'd be glad to help people and answer questions. There's some other links that I could share to help people get more involved. And then finding out in your own area who the advocates are and going and talking to them is another thing. Let somebody know that you're looking to get into this business. And they many times are very helpful to help mentor people to come into advocacy.
Okay. Okay, wow. We just covered a lot. So we talked about our different groups and associations that advocates can get into to help them with that, those business strategies and legal forms and keeping up to date and things like that. Let's just go back for just a second about marketing. Is there anything else that you can tell us about marketing? I mean, what would a first step be to market yourself? So you have yourself all set up, you've got your forms, you're ready to go, you got your insurance, and now you got to go out and try to find clients.
Well, there's a number of ways to do it depending on who you want, what population you want to work for. If you're looking to work, you can go to employer groups, some employer groups, because if you think about this, of a man who works maybe for American Express, I'll just pick a company because we have American Express here. American Express, his wife had a baby who had some complications. He's in intensive care, newborn intensive care, has some really serious medical problems that are going to be long-term. This man is spending a lot of time at work on the telephone, calling the insurance company, finding out if benefits are covered, if his child and they need a nurse, they have home care. So through an employer may have an advocate on their staff per diem as needed to help with the employees who have medical problems that come up. Somebody diagnosed with cancer might need an advocate to help them, especially if they've been in treatment for a while, now are finding out that they're running out of alternatives. Maybe they need someone to help them research clinical trials. Doing that yourself can take a lot of time. So the employer may say, well, we can put you on staff 20 hours a week, we'll pay you X amount of dollars, and you'll be a resource for our employees to help them with their medical questions that they might have. So visiting employer settings and, going to the Chamber of Commerce in your town might be one way to meet employers who need that service. So understanding what niche you want, maybe going to case management meetings, the national meetings, and working with other case managers. Sometimes case managers see patients for a short period of time. They may say, well, this person can really use an advocate long term. Let me introduce you to them. And then you can talk to the person about it. So there's a lot of ways. It's finding that need, who needs you, and then a lot of it's word of mouth. Somebody has an advocate, they have another family member or friend who has a family member in the same situation. And they would say, well, I had an advocate, she really helped me, let me give you her name. And then that's another way to get, market. Getting out there, learning what's in your community. Many advocates write articles in mainstream journals, in Oprah's magazine, about how a patient advocate could help somebody. And again, they may call you, you might not be in the same area, but you could direct them to another advocate in the area, or some advocates do handle things long distance. They do things over the phone to help people. So again, depending on what the person's business model is, they'll be able to develop that.
Okay. When you were talking about connecting with case managers in, like, say, the hospitals in your area, I think that's an amazing idea. If you just kind of, network with them, go to their association meetings, maybe even get invited as a guest speaker at, one of their meetings. I think that would be, it seems to me that would be an amazing pool, from which to draw, because
Right.
Like, that's true. Like you said, those hospital case managers, they're in there just for that acute period, or, maybe a little bit longer, 6 weeks, 8 weeks, whatever they have, depending on if they're coming from an acute care facility, or if it's more of a, skilled nursing or something like that. But that is a really good point. I like that. And also your point about going through employers, because they definitely have that vested interest. They don't want, of course they want to help their employees, but at the same time, they don't want their employees spending all of their time on the computer and on the phone.
Mm-hmm.
So
it's very time consuming to research information. And so that's where advocates can help and that's how you would approach it with an employer, to increase productivity of when people have medical challenges, either as a patient themselves or as a caregiver. The wife's sick, but the wife is sick, the husband has to make all the phone calls. You know what I mean? So yes, getting into that is it really, productivity is important from the employer standpoint. So one recommendation I would say is be as inventive as you can, and to look at all the different avenues. There's like going to the library and asking the library if they ever do little services for the community, and then talk about advocacy. And they advertise that for you, and then people come at 7 o'clock at night. It's kind of like a book signing. You would be there to speak on advocacy, and some libraries do that. Some long-term care facilities are independent. People are independent. They're living there independently, but they may bring you in to talk to their community who lives there, continuous care centers, and what some of the challenges seniors face, if that's the area that you're specializing in. New Medicare programs that are coming out. If you're a billing advocate, how you can help people understand how to sign up for Medicare, or how to change their policies if they want to go from traditional Medicare to an Advantage plan, or from an Advantage plan to traditional Medicare. People need that information, and this is where advocates come in to help with that information. Right.
Okay, now we haven't really touched on like payment. We did talk about like that it's a private pay situation. I'm just wondering, like, how does an advocate charge? Is it like a retainer? Do they charge hourly? What is there an industry standard?
There really isn't a standard, but yes, many people do per hour, or they can do they can take a retainer. You could pay $1,000 and I'll use this. And then that advocate would document their time and what they did for that time, and they would give the person an account, and again, part of the agreement that they sign when they come on, this is what I can do for you. They would establish their prices. You know, some advocates are, as I mentioned, are professional advocates, registered nurses. There are actually physicians who are advocates. They're not doing hands-on medical care. Advocacy is not medical care. They're not treating the patient, but they're giving advice, they're giving information, they're giving guidance to the patient or the caregiver. So fees can range anywhere from $50, $75 an hour all the way up to $100, $200 an hour, depending on who the advocate is and their background. And then again, what you need done, what you want the advocate to do for you. So there has to be like an assessment up front, and then the advocate, if the advocate's able to do what you want within their scope of practice, then they'll tell you what their rates are, and then a contract would be signed. There is a retainer, the retainer can be paid, and then as that retainer winds down, the advocate could say, well, this is what I did so far. We still can do a few more things, but maybe the patient or the caregiver by then has learned what they need to do and can take over at that point. Mm-hmm. So advocates are really in the business of training and educating and empowering people to be able to manage their own care. And that's what we want to try to do. Not really maintain somebody forever if they don't need it, but do it in a reasonable amount of time, at a reasonable price, and meet their needs the best they can.
Okay, I'm my wheels are turning, and I have really just sort of one last question on that, and that is, you know, somebody has to have some money in the bank to be able to pay an advocate. Okay, is there some way that an advocate can serve, you know, somebody without that income? How do you set up some kind of a payment? Is there any kind of way to have that subsidized or?
Well, there are some advocates that are starting to look at getting grants through different organizations that might understand that people do need advocacy to help them move forward. So there are, I don't have the names of those organizations because, again, they're in development, but that is something an advocate, if they can go to Health and Human Services or to the local charitable organization in their area and say, I would like to help you manage your population of people when they have medical problems. I can do it for X amount of dollars. And then they would be the payer. They would pay the advocate versus the individual person paying the advocate. So there are some, I'll just give an example of an idea that one of the people who had met last year talked about. He owned condo association in South Florida. And we have a lot of condominiums here with people coming to Florida, snowbirds, or they might live here all year long. They've retired from up north and they've come down to Florida. And his idea was to put an extra $10 into the condo fee. So that would be somebody who lived in that condominium through the condo association, they could get an advocate as part of that benefit. So that's what I mean by creative ideas, finding people who maybe already are charging people something and adding additional fee onto that for your services. And that would be an idea.
That is very creative. I like that idea. My question is now, what about like Medicare? Does Medicare pay for this, or can you bill Medicare?
No insurance really pays for advocacy.
Not even Medicare.
Medicare's, pays for medical insurance. This isn't insurance. This is kind of like a service that a professional performs. So again, like a financial planner is individually. You might meet with him 4 times a year, you might meet with him once a year. He'll send you statements of how you're doing. This is the same type thing for an advocate, understanding what the situation is, letting you know what they can do based on their experience, and then helping you navigate the system the best you can to meet your goals as a patient.
Okay, I see. All right, well, I was trying.
Yeah.
I tried. Okay.
Some long-term care policies may pay for an advocate, long-term care
Right. And
insurance policies.
Yeah, and I was wondering about that too, or even
It's individual. It's individual according to the policies, so people would have to check their policies. Right now, there are some, but again, I don't know which ones they are, but people can check their policies to see if they have that. Because, again, people need direction. They need help navigating the system. And that's where advocates come in.
Right, right. Okay, well, thank you for all your information. That was pretty amazing. We'll be sure to include the links to those resources that you shared, because those are very valuable, helpful links that anybody interested in becoming a patient advocate would need to be aware of. And do you have anything in closing that you would like to share with our audience?
No, just for nurses that are interested in looking at something different, this is a good career. A lot of nurses who are retiring are looking at becoming advocates as they retire as a part-time type job, because they have extra time and they still want to work. They don't want to work as hard, maybe in a full-time job. So advocacy is a good part-time position for somebody. And if anybody again is interested in learning more about it, feel free to email me. I would love to talk to you and just introduce you to the practice and connect you with people that I can connect you with that can give you more information.
All right. Would a nurse be able to contact you through your website, through your blog?
It's better to directly email me, because
okay. So what I'll do then, in the bottom of this interview, I'll go ahead and put your contact information in there, so anyone interested can contact you that way. Okay.
Perfect.
Well, what a great day! Another great interview. Thank you so much, Anne, for your words of wisdom. I appreciate that, and I know that our viewers appreciate that too.
Thanks for what you're doing and helping nurses realize all the different alternatives for them. There is a lot that we can do through our expertise, through our training, and just through the work that we've done, our background, really prepare us for these new emerging trends. So it's exciting.
It is exciting. It is exciting. I love being able to show nurses ways that they can be a nurse outside of just a clinical situation. Because, for whatever reason, some of them, they burn out of nursing, they get fed up with the bureaucracy, or they get, have an injury or an illness or something that precludes them from being able to work in a clinical environment anymore.
Right, or they're just ready for a next step. I think a lot of nurses, we not that we outgrow, or we do outgrow our roles, and this is definitely a next step for people.
Right, right. Okay, well, I thank you, Anne. And so again, this is Christy Hendricks with Change of Shift. Nice to have you joining us, and I'll see you next time.